Infectious diseases expert Sanjaya Senanayake joins us now from Canberra. Good morning to you. Thanks for coming on and having a chat about this, because I guess the first question is a lot of people asking, should we be worried?
Yeah, good morning, Lisa. So monkeypox is not on the same scale as COVID, so it's not a respiratory virus and it doesn't send lots and lots of people to hospital. So it's on a different scale to COVID. But there's certainly some unusual aspects about this outbreak, and it's involving multiple countries and seems to be growing at the moment.
Where is it? We've heard from the concerns in the US. We do have, what's the situation in Australia now? Is it one case, more than one?
So we have 2 confirmed cases in Australia, and I believe they're both from travellers who've come from somewhere else, and about 12 to 14 countries around the world, predominantly in Europe, have been reporting cases.
How does it get spread?
So this is a virus that needs to be in close contact with someone to spread, so close physical contact, touching bedding, clothing of those people who are infectious, potentially droplets as well.
And what are the symptoms that people would see?
So it tends to have 2 parts to the illness. The early part, Lisa, is about 5 days of a very high fever, very nasty headaches, muscle aches and pains, and then a rash starts. Now, usually this rash involves the face and spreads down, involves the palms and the soles, but we're hearing reports from Europe that there's a preponderance of genital lesions with this one, and that's one unusual thing about this outbreak. Potentially it could be spreading through close, intimate physical contact.
And so why are we suddenly talking about it now? Because it previously hasn't been seen too much out of Africa, has it?
That's right. You get sporadic outbreaks when the rodents that carry it are imported to another country from Africa and infect someone else, and you get the odd person returning to a country in Europe, for instance, and spreading it there. There are probably 2 reasons, Lisa. One is that there's been such a big emphasis on COVID surveillance. We haven't been as closely looking at other things, and now people are, so they are picking up cases, and also people are now moving more closely together, particularly in the Northern Hemisphere, which is allowing it to spread. There's some whole genomic sequence data suggesting that this particular strain might be similar to a strain that was identified in Europe in 2018. So potentially it's been in Europe for a while and just been under the radar, causing tiny outbreaks that haven't made people too sick and have been missed.
All right, and look, just before you go, I do want to ask you the current situation with COVID. The pandemic was barely discussed during the election campaign, but the daily numbers and the hospitalisations and the deaths are still very high. What's your gut feeling about it?
Yes, so at the start of the year we were hoping everyone would, we'd have a big Omicron outbreak and then COVID would peter away, but we're not seeing that, Lisa, with all the sub-variants that are appearing. COVID is here for the rest of the year, and I think the hospitals are going to have to deal with its own long COVID, where you're going to see a trickle of cases keeping hospital staff busy and occupying hospital wards.
All right, Sanjaya Senanayake, thank you so much for coming on this morning.
Thank you, Lisa.